So, questions? Okay, we have a question there in the middle, and we have a question towards the back. That looks like Ricardo, is it? So we can have the person at the front and the person at the back, who might be Ricardo.
Hi, is this on? Cecilia Kinstrand from Swedish Match. I don't have a question. I'm just really, really impressed what you're doing on the pregnancy bit, and you should take that to other countries as well. I mean, it's an amazing work. That's my comment. Thank you.
Hi, this is
okay.
This is a message for Linda. Question you then. So we've seen already in Nottingham that midwives are taking this on board with the e-cigarettes, and it's slowly filtering through. But obviously, pregnancy and childbirth is a multidisciplinary kind of approach that we have in the UK. And what we're seeing is that it's not necessarily being translated through to nurses, healthcare assistants, and doctors. And I wondered what the plans were to try and bridge that gap.
Yeah, is this on? Yeah. So you're absolutely right. And actually, obstetricians are a particular barrier.
You might have to be a bit closer to the mic.
Sorry, yeah. Obstetricians are a particular barrier. So I think we are doing a range of work in this group that I mentioned. We have a public health trainee, Misha Moore, who's just finished doing a survey around smoking cessation generally amongst different professional groups working with pregnant women. So we will be trying, as time goes on, to develop more resources, but also to engage. So we're going to professional conferences. There's all kinds of things. Deborah's waving her hand, which means she wants to add something.
Just to say that the project that the Health Registrar did was not just about going around and surveying, but looking at training needs. Yeah. And we've been talking to, the GPs, the Royal College of Nurses, the obstetricians, because the initial need was with midwives, but you're quite right. What we found is it's a much broader network of healthcare professionals you need to engage, as well as engaging women themselves and make sure that women talk to other women about it.
Yeah.
So we have the person at the back, and we also have Martin Jarvis at the front. So we can have the person somebody at the back did indicate they want the question. Do you still want the question? Well, it's the person with with grey hair on the right. Well, some grey hair anyway, on the right. Is it Ricardo there? So my right, your left.
Martin, it's Charlie Hamshaw-Thomas from Nico Pure Labs.
Okay, I meant the other man with the grey hair on the left of the person with the microphone. There you are.
Is it me?
That
yes,
is Ricardo.
I didn't want to admit that. Sorry, I have a question for Lars and one for Linda, actually, a comment. Lars, do you have any data, knowing the importance of mental illnesses in relation to the tobacco harm reduction principle, and do you have any data about snus and the impact of snus on schizophrenia or mental-related illnesses in Sweden? And Linda, I'm very glad that you are taking this crusade into pregnant women who smoke, because that's very important. But as you know, Southampton General Report in December 2016 clearly states that nicotine is extremely harmful to fetuses and pregnant women. So, who's wrong?
I'm afraid I didn't understand your question. My hearing is a little bit limited, so...
The question was, is there any evidence about mental illness and snus use? The relationship between mental illness and snus use?
Between?
Mental illness, like schizophrenia and other mental illnesses, and snus use.
Ah. Oh, no, I'm not aware of any direct data on exactly that relation, I'm afraid so. But we have to rely on theoretical considerations only.
Okay, we can maybe come back to that. I think the Surgeon General's wrong.
Right, I think Martin had a...
No, so, there's a long history of, even getting nicotine replacement therapy for pregnant women in the US is very difficult. Health professionals are very, very, very reluctant to prescribe it. So there's some big issues in that country which are more about nicotine, as the case with other countries as well, than they are about e-cigarettes. I wrote in response to that section in the report. It's just not accurate.
Okay, so Martin had a question and then Charles at the back. So Martin at the front. Martin, do you want to put your hand up? That's it. And then I'm going to ask you to run all the way back to Charles at the back, who you already know because he submitted his question in advance.
So this is a question for Ron. You know, I think I've often heard it said that, you know, that dual use in America seems to be a sort of different phenomenon to dual use in Europe, and there certainly seems to be much more concern about it there. So I don't think you presented anything on the patterns of dual use in your ITC study across the different countries, but did you see any differences in the patterns of dual use across countries?
We've really only just started to look at it, Martin, so I can't give you a definitive answer. There's a higher degree of daily use of vaping devices in the US relative to the total use, which I did report. When we've been looking at the relationships with quitting, we haven't found any interaction by country. There's no interaction at all. The odds ratios for each country are very, very similar. So my initial guess is that it's a bit of a myth, but we really haven't done all the analyses we need to do to confirm that. Certainly the levels of beliefs about harmfulness and those sorts of things are very, very similar across countries.
Charles at the back, and then something I can see a black sleeve right at the back. Can the person with the black sleeve stand up so I can... Right, if you could ask the question after Charles, that would be great.
Ron, oh, sorry. Ron, your slide was very good in terms of it showed the dramatic effect and obviously the scale you used, and you were right that it is disastrous the way that perception has gone the wrong way. What plans are afoot to try and start turning that in the right direction?
I really don't know. It's events like this which talk about the facts and increasingly reporting the sorts of evidence we've seen reported here about the situation of snus use and its potential major contribution to health in Sweden. The data that was Martin released a couple of days ago showing large decreases in smoking in the UK and quite high levels of vaping. I think all that's moving towards people feeling more comfortable about the product, and I think we're going to have less of the Simon Chapmans of this world distorting the evidence. But at least I hope so.
Hi, my question is for Helen. Well, two questions. So the first is that 2005 New York Times article. Could you provide some context or a little background, like when that happened? I would be interested, and if you know who the companies were that were involved, I would be interested to know. And second, the idea, what are your ideas or plans for getting around the FDA regulations that would prohibit tobacco companies from giving out those free samples?
So that article that was written in 2005, they basically went into, I mean, there's hundreds of thousands of essentially declassified documents from the tobacco industry. They weren't actually able to go through all of them because there's so many, but Lori Lard, R.J. Reynolds, all of the tobacco companies supplied psychiatric hospitals, homeless shelters. They were all involved to a certain degree, and it's a classic tactic, right? You give out free samples to get people hooked, and they go through why they consider them a downscale market, but still a very lucrative market for their product. I think somebody has to write a more updated article and go through some of those documents again. There's just hundreds of thousands of them. So I think another article needs to be written. In terms of your second question, I don't have an answer to that. I think in the coming years, we don't know what's going to happen in terms of the FDA, the deeming rules, if that's going to change. But I think we have to figure out a way to get electronic cigarettes into the hands of the people who are dying at the highest rate. So I don't have an exact answer for you. I think it's something we're going to have to think about and strategize about going forward.
If people could just identify themselves before they ask the questions. And yep.
Hello, I'm Peter Lee. I have two questions. One for
Peter,
Ron,
you need to use the mic.
Sorry. One for Ron Borland about the ITC study. I understand it's limited to people who have only ever smoked in the last few years, who have a history of smoking or tobacco use, I should say. But is there any information on the gateway at all from this? Like, have you got any information on the sequence of use? How many people are using e-cigarettes before they smoke? And my second question is to the panel generally. It's now eight or so years since e-cigarettes have been on the market. Everyone seems to consider they're much safer, but there is in fact no worthwhile health evidence on e-cigarettes. It's only inferential from doses of chemicals. Why isn't there a prospective study looking at comparing risk of heart disease, for instance, in e-cigarette smokers and non-smokers? It could be done in 2 or 3 years. Thank you. That's for the panel generally.
In response to the first question, Peter, most people in our studies started smoking well before they started vaping, because vaping's only been in the young people. We haven't looked at that. We've got a parallel study that's looking at 18 to 25-year-olds and a large sample of those, which will be able to look at some of those issues. That data's in the process of being collected, or it may have just been collected. It's a large online survey across 3 of the 4 countries. It's a very difficult question, and I think the longitudinal data is very much prone to misinterpretation, because the sorts of people who would have taken up smoking, some of them are being displaced to vaping, some of them will go on and smoke. The people who weren't going to do either probably will continue not to do either. So I think we need to be looking at the cross-sectional trends in countries as has been the case in the US, for example, where vaping has been going up and smoking is going down. Now, although I believe that the vaping rate among kids in the US may have dropped a little bit more recently, but smoking rates have continued to go down. So there's no temporal relationship. So gateway is basically dead. Anybody who claims there's a gateway effect is...
There are a number of studies in the States.
Again, Peter, if you could use the mic.
Sorry. There are a number of studies in the States. It's presented at some other recent conference. I wasn't there, but I've seen the details, which were claiming that if you compare longitudinal studies where you compare people who have never used tobacco with people who have only used e-cigarettes, that the frequency of smokers to a year later was substantially higher in the people, and they had adjusted for a whole range of potential confounders. I know there are limits to how accurately you can adjust. It's a very difficult problem, I agree, but I don't think the story is quite dead.
So if we could have Ron and Linda's answers, that would be great.
Yeah, but look, there certainly are those studies, and there's bound to be more of them, because in a context where the percentage of who are eventually going to smoke is quite low, you've got a very high percentage of people with a very low probability and the capacity to control for all those variables, as you know very well, Peter. We only ever partially control for all the things we purport to have fully adjusted for. It's one of the myths of science.
Yeah, there are 10 of those prospective studies in youth, and I mean, they all have the same problems. We're going to have one published from the UK in a few weeks, which basically shows the same thing. But Ken Warner and Andrea Valenti, who are experts in causal inference methods, they've I think this is the presentation you're talking about, they very clearly map what the problems are with those studies. So for me, the key thing is, particularly for young people, unless we see population tobacco use rates going up, it's not happening. But just on your first question, the second part of your first question, in terms of longer-term health effects, there's a large amount of research going on at the moment, many studies. In terms of prospective studies, one of the big limitations we have is separating out smoking from vaping, and the fact that vaping is difficult to measure, and it's a very complex behavior in terms of amount, duration, etc. So to look at health effects, we actually need a cohort of people who've never smoked, who regularly vape. And those people only exist in the tiniest numbers. Just finally, there's a study in Bristol at the moment looking at DNA methylation where they're trying to recruit never smoking vapors. They're finding it almost impossible.
Yeah. Can I just slightly disagree with Linda on that? I think there's a huge potential for a cohort study looking at smokers and looking to see the impact of having quit smoking and continuing to vape as compared with quitting smoking and not using any forms of nicotine. I've been arguing we need to have something like that, and the sooner we get it into place, the sooner we'll have the long-term answer. But in response to your question, all we know about the mechanisms of disease, the mechanisms aren't there in very large amounts, and in fact in some cases they're there in no amounts or microscopic amounts. So I think it is highly plausible to assume that there's going to be a way less harm associated with these products in the long term.
Okay, Peter, I've already prohibited dual use of the mic. It's now time to cut down to stop. We've got two people sitting side by side. If you could give us the last two questions, we'll come to the panel for their final comments.
Okay, so back to Linda, and this is building off the other question about the nicotine. Now, if we've got questions in here about the role of nicotine, I know from my work with online forum data that there is a great misunderstanding of nicotine. Women are saying that it alters the brain chemistry to make babies sleep deeper, so it's nicotine that causes sudden infant death syndrome. I've heard that it causes allergies, that nicotine causes cancer. And these women are sharing articles between themselves from things such as the Daily Mail or from Wikipedia. And I think it was Deborah I was talking to yesterday. When you're heavily pregnant or you've just had a baby, you want whatever is going to take the minimal effort to take in because you are exhausted. So it begs the question, when we're still not getting the message across, there is still this great misunderstanding. And when it comes to things like NRT and using e-cigarettes, we're not translating that information regarding nicotine well enough that women are willing to give it a go. They are still really, really confused about it. So what do we do?
And Louise, your question?
Thank you. Louise Ross from Leicester City. Linda, I know you've shown great leadership in your research by using the lived experience of vapers to help frame what you're doing. Could you just say a little bit about that? Because I think that's just really important.
Linda, if you can add to that your final comments, and then we'll move to Lars and Ron.
Okay, just the first point. There are many of us working very hard to try and address this. I think I need to get back on Mumsnet, as I did a couple of years ago, and Deborah and I need to talk about that. I'm happy to go on there again and answer all the questions and whatever is needed. But I think the work with the health professionals is crucial. Just on Louise's point, we are working with a new nicotine alliance, and we have been doing that for several years with stage 4 lung cancer patients, where we take an experienced vapor into the home of these patients with one of my team. They introduce them to the products, they find the nicotine concentration and flavors that work for them, and then the experienced vapors support them over the phone. And I don't know if Andy's here. You hear Andy Morrison? No? The man is a saint. I mean, he drove, I think it was 3 hours from Glasgow to Alloa to visit one of our lung cancer patients at very short notice last week with minimal recompense. So we couldn't do this research without the vapors. I'm very grateful.
Lars, do you have any final comments?
Lars, final comments?
Ron.
Just one extra point in response to Martin's question. One difference in the US is that there's much greater use of non-tank systems, And that seems to be associated with a far higher percentage of people in the US accessing their vaping devices from convenience stores and through the sorts of networks that that the bigger companies dominate, and less from vape shops. That may have something to do with the relationship, but that's pure speculation. Beyond that, I'd just like to say that I think what I presented hopefully starts to dispel some of the myths around the potential evils of vaping, and I think we need to continue to focus our attention on dispelling those myths, because almost without exception they are complete myths.
My final comment is really a plea to people, and that is we need more research on electronic cigarettes that doesn't exclude people who have a serious mental health diagnosis or people who use drugs. I don't think I've heard, lots of studies have been mentioned yesterday and today, and I don't think any of them included these populations who are using combustible tobacco at very high rates. So this is a plea to scientists and researchers, start doing this research, because we're going to face what Linda is facing around pregnant women. Well, there's no research to show that electronic cigarettes can actually help pregnant women. We don't have the research in these particular populations, and we need that. But that's not a reason to not go ahead if you work with people who have a psychiatric diagnosis or drug users. It doesn't mean you don't start talking to them about it and saying, check out vaping. And again, just another plug for our meeting at lunchtime today. We'll be in Ballroom A, and all are welcome to come and talk about these particular populations and how we can help them transition. Thank you.
Okay, we're going to pause now for a break, but if you think I've been strict, wait till we see Sarah Jakes chairing the next session. You're not going to want to be late for that, because Neil Benowitz is going to be speaking, but could we thank the panel in the usual way, please?